Jane Rockstrom's brilliant introduction yesterday about the planetary crisis reminded me of a quote from the historian Arnold Toynbee, who said, civilizations die from suicide, not murder. And that's a depressing thought that hangs over this conference. But my spirits were lifted by Bill Clinton, who talked about networks of cooperation. And the quote I liked from him was, people can do anything as long as they feel they can make the future better. So I want to talk about the very basic forms of human networks of cooperation, our ancestral forms that were so successful for humanity. Let's start with public health nutrition as a social behavior. When I was born, my mother was exposed to this kind of information, that you start cola earlier, that more doctors smoke Camels. So I was brought up drinking Coke and smoking Camels. But now we're all getting fat and we live in a different kind of message environment, but we also live in a world where 2.5 billion people live on less than $2 per day. So what can we do about it? We know about the risks from non-communicable diseases, and a lot of other people have spoken about this: obesity, heart attack, stroke, stress, respiratory disease from air pollution. We did a study 20 years ago of giving messages to women in Kathmandu, poor women. We did a randomized controlled trial of health education. We gave them the information in the hospital, we gave it to them at home, and the trial showed absolutely no impact whatsoever on knowledge, attitudes, or behavior. And I remember giving a talk about it, and a woman put her hand up and she said, "You didn't seriously think you'd change behavior, did you?" And I said, "Well, I'm a doctor, you know, you give information to your patient." She said, "Yeah, but you know about Bandura's social cognitive model, don't you?" And I kind of coughed, you know. And then she said, "Well, it's all about peer pressure." So I began to learn that actually you change your behavior from your peers, about what you find around you, your family and friends. And we discovered about the Bolivia Warmi project that was about women coming together to talk about reproductive health. And I'm a pediatrician. We were interested in cutting newborn deaths. So we said, can we do this in Nepal, but let's evaluate it in a proper way with a cluster randomized controlled trial. So in a sense, development, I think, is about that. It's about trying to think about technology and information, but ancestral forms of coming together, peer groups. And the other thing that I've learned from Sarah Hrdy, who's an anthropologist, is that we are one of the few species that does cooperative nurturing. We're like meerkats, we're like bush-tailed tamarins. It takes a village to raise a child. First thing you do when you have a child, of course, is give it to your mother-in-law and go out to dinner at an eat restaurant. But we're not like chimps. Chimps don't do that. Chimps will always chimp mothers will keep their babies with them. So the other thing to remember is what Robin Dunbar taught us, which is that we work in survival cliques, our families, a tripling to sympathy groups, and I'm going to talk about those. We triple up to our affinity band, and the limits of the social brain are our active network, the Dunbar number of about 150 people. So this is Nepal, rural Nepal, where we set up a study looking at these different groups of humans, and we looked particularly at the role of sympathy groups, and we took their community action cycle from the Bolivia project, where women come together and talk about their problems, they plan strategies, they put them into practice, and they evaluate them. And we set up a cluster randomized trial in Makwanpur, and we ran it for 3 years. And one woman would run 9 groups in 9 wards. This was over 1,500 square kilometers of mountain without any motorable roads. And we showed a 30% reduction in the areas where we had groups in newborn mortality rates, cooperative nurturing, survival. We were really surprised. We published in The Lancet. The silence was deafening. Women chatting, reducing mortality. That's bonkers. So we did another study in East India, an even bigger study in 250,000 population, tribal Orissa and Jharkhand. Again, a 1/3 reduction in newborn mortality. And we did another even bigger study in 500,000 people in 3 districts in Bangladesh. No impact. Sent both papers to The Lancet. They said, we like the India one. He said, you can't do that. The negative trial is really important. Why didn't it work? And we thought it's probably about coverage, that we didn't get enough women into the groups. So we went back, we did another 3-year study, we tripled the number of groups, we got a 1/3 reduction in neonatal mortality. We also did 2 studies in Africa, in Malawi, which again showed contrasting effects related to coverage, and one in the slums of Mumbai, Slumdog Millionaire. And that showed no impact because baseline mortality rates were too low. So the overall impact was, if you look at the lower line, it just shows that where you get at least 30% of locally pregnant women into groups, you can cut neonatal mortality by 1/3. And we found the same effect when we meta-analyzed it all with 120,000 on maternal mortality as well. So chatting in groups works. Why? It's about knowledge sharing, it's about individual behavior, undoubtedly, about the sort of things that you see there, washing hands, using nets, and the like. But it's also about social support, about women coming together in solidarity to give support and funds. I also believe it's about fewer obstetric complications. Michel Audin, the French obstetrician, talks about oxytocin bathing your brain and controlling your delivery and controlling breastfeeding. But the antagonist to oxytocin is adrenaline. And adrenaline arises from stress. So stress a mother, you increase the number of complications. And actually, the best way to stress a mother is stick her into a hospital, particularly in London. Social support extends. You don't control this intervention. Women set up small businesses. They arrange for bicycle ambulances. They give loans to one another. They get involved now, 7 years later, when we've withdrawn all the women's groups running in Bangladesh, and the women are joining political parties and standing for election. This is one of the most subversive interventions that you can actually use. It really reflects what Paulo Freire taught us about empowerment and critical consciousness. So ancestral sympathy groups are extremely important, and I think they apply to sustainability in Sweden and London and the US. There are additional effects on gender equality. Men do get involved. This is not about gender apartheid. It's about women giving the voice and power to then bring men in as and when they wish. It also has impacts on services in ways that are difficult to quantify, but do impact on field workers and on the quality of care delivered to women because they demand more. And interestingly, a lot of the groups get into planting trees, they get into the environment, they get into kitchen gardening, partly as a way of generating cash, so that there's a resource when there's a crisis. And finally, can you scale this thing? Is this just a small-scale thing? This is Aarti Ahuja, who I meet next week. She's an Indian civil servant, and she has shown that you can scale up in Orissa, the entire state. She's scaled up 50,000 women's groups using this model, and she's done it with state budgets. So this is not something that we can't do. We now need to experiment with food and food security, which we're doing with sustainable agriculture. But we've got to do it in Sweden and UK and America, because getting groups together is a way that we're going to change a sustainable for you for the future. It's not all about mobile phones and messages. It's actually about ancestral mechanisms of generating trust. Thank you very much. This is a final quote from Richard Horton about our program in The Lancet. And if you want to follow me on Twitter, I'm the Global Health Twit. Thank you very much.